So today we're going to discuss the basic procedure for doing an upper gastrointestinal contrast study. And this is Mona. She's one of our clinic kitties here at Midlothian Animal Clinic, so she's going to be our patient for today. And essentially some of the indications for why you would want to consider doing an upper GI contrast study would be persistent or acute vomiting or diarrhea that hasn't responded to treatment previously, anorexia, blood in the stool, different things like that. Or if you suspect that there are lesions or masses, that's Peggy, our other clinic cat. Or if you just are concerned that there are lesions or masses in the gastrointestinal tract that you want to be able to locate on radiography. So some of the things that might be contraindications for doing a contrast study would be if you suspect that your patient has bloat in the event of it being a canine patient, or you're concerned about obstructive bowel disease or anything like that. Sometimes if there are perforations or possible rupture in the GI tract, that can also be a contraindication, or it would kind of cause you to readjust what kind of contrast media you might use. So for Miss Mona, basic things that we would want to do to get her ready for the study, we would want to make sure that she was fasted for at least 12 to 24 hours before starting the study, just to make sure that there wasn't any food matter or anything that might possibly obstruct lesions or different things that we were looking for in the GI tract. We would also want to administer an enema about 2 to 4 hours before doing the contrast study to remove any kind of gas artifact or feces that also might obstruct our view during the study. So oftentimes with studies like this, general anesthesia or tranquilization would be inadvisable, just because a lot of different anesthetic agents can actually slow your GI transit and motility, which would affect the results of your study. So although a lot of times taking this many radiographs that are required for doing these kind of studies, some patients won't necessarily tolerate it. But again, if you're able to proceed without doing kind of general anesthesia or tranquilization, that's ideal. Some sedation may be required, which again, you just kind of want to base it as you go. So what we're going to use for this positive contrast study for her is going to be a barium sulfate suspension 60%, which is the most common one that's used for upper GI contrast studies. It can sometimes move a little bit slowly throughout the GI tract, which obviously can, again, affect your study, but chilling it actually can help with that. If we were suspecting that Mona had a perforation or a rupture anywhere in her GI tract, we would want to use a water-soluble organic iodide instead, which would be more appropriate in that event. So for her dosage, this is essentially the rules of thumb for oral dosages for the barium sulfate suspension 60%. For feline patients like Mona and for dogs that weigh less than 10 kilograms, you're going to give about 8 to 10 milliliters per kilogram. For dogs that are between 10 and 40 kilograms, you're going to give 5 to 8 milliliters by mouth, and then or per kilogram. And then for dogs that weigh over 40 kilograms, you're going to give 3 to 5 milliliters per kilogram orally. So Mona weighs about 11.3 pounds, so that makes her roughly 5 kilograms. So her dose is going to be somewhere between 40 to 45 milliliters by mouth, which we are going to administer to her. We have our 60 cc syringe, which we'll draw up our barium with, and we can either give that directly in her buccal pouch, if she'll tolerate it. We don't actually have an oral speculum here, but sometimes we kind of rig one up using tape. We can place this in her mouth, and then we have a gastric tube, which we can administer, or inject rather, the barium from the syringe through the tube and try to get it closer to, down her esophagus and closer to her stomach. Again, this is another time to keep in mind that not all patients will tolerate this without any kind of sedation, but if you can proceed without using tranquilization, that would be ideal. So we are going to go ahead and take a break. We're going to get all of our PPE on for taking our radiographs, because the first place to start is to get survey radiographs of your patient, both lateral and VD, because sometimes those can honestly be diagnostic enough to eliminate the need for you to do a contrast study. But even if you still take those and you still want to proceed with the study, you'll already have your X-ray technique solidified, you'll have your positioning solidified, and you'll also have something to compare and contrast with later on. Go ahead and get her in position. We're going to do our lateral. So we've got her in that right lateral recumbency here. And then we'll go ahead, and we've got our calipers, so we're going to take our measurement. And we're trying to take our measurement roughly at the level of her liver. So we've got about 8 centimeters. So based on that, we're going to go ahead and set the machine for 65 kVp and 5 MAS. That's what we'll use to get our abdominal views, and then we're actually going to bump up our kVp by 6 to 8 for the actual contrast study. So if our survey radiographs aren't diagnostic enough, we'll go ahead and proceed with the study. As I mentioned before, we're using the barium sulfate suspension 60%, and we will draw up her calculated dose, which again, based on her weight, is roughly going to be about between 40 and 45 mLs. We can either give that to her orally, if she'll tolerate that, or we can actually use this gastric tube to insert it a little bit farther down her GI tract. So because cats have such a fast transit time, to get the contrast study of her stomach, we need to take the first x-rays immediately. So we'll administer the barium and then immediately take 4 views of her cranial abdomen. We want both the right and the left lateral, and then a VD and a DV. And then after that, we will take her following x-rays for the study at these following intervals. So again, immediately we'll get her stomach in the for the study. 5 minutes after that, we'll take just a lateral and a VD, and then we'll be able to visualize her stomach and her duodenum. And then roughly 30 minutes after we administer the barium, we'll get her complete small intestine. And then 60 minutes after the barium has been administered, we should get the small and the large intestine. For canines, it's a little bit, their GI transit time is a little bit slower. So again, the immediate view that you would get for a canine patient, you'd get your stomach. For 30 minutes after administering the barium, you get the stomach, duodenum, and jejunum. Then 2 hours later, it'll still be in the stomach, and you can probably most likely get the full barium in the entire small intestine. And then 4 hours after administering, you'll get the small and the large intestine. And for both canine and feline patients, your upper GI contrast study is complete once you see the barium in the colon. So that's essentially the procedure to, the intervals that you need to do in order to do the contrast study. And as far as for labeling, all of the x-rays for any patient that you're doing will have the patient's name, the clinic name and address, your technical factors that you've used for your machine, and most importantly, a time stamp to denote when each x-ray was taken in relation to when the barium was given. So that is essentially the procedure for doing an upper GI barium study.